Hello, I'm Roslyn Law. I'm a consultant clinical psychologist and I work in the Anna Freud National Centre for Children and Families. I work in the service for adolescents here, and mostly I work with young people who are having difficulty with their mood and in relationships, often with perhaps parents or their friends. There are a lot of ways that you can tell whether the therapy and the treatment you're receiving is helping for you, and it will be very personal to each young person. You might notice that the problems that you've identified at the beginning of your time in treatment start to feel a little bit easier to manage. You might notice things like your mood changing. Maybe you were sad a lot of the time before, and now you notice that there are breaks in that. You start to occasionally feel happy. If you were anxious, you might notice that your confidence is increasing and you start to be able to try some new things or go back to the things that you used to enjoy. You might notice that you start to feel more comfortable spending time with friends. The sessions might even start to feel a little bit easier to manage. If you've set some goals, you will probably start to notice that some of the things that really seemed out of reach to you at the beginning of treatment start to become realistic. They become possibilities for you. A therapist will use a lot of the same clues that you do to work out if therapy is helping. But sometimes what they need to do is find ways to measure the things that you're feeling inside because they aren't so obvious to other people. So they might use things like questionnaires, or you might have agreed some goals that you're working towards that you would rate regularly. So it's a really good idea to fill in those questionnaires repeatedly during the time that you're meeting, maybe every couple of weeks, or to rate your goals again regularly, and you can watch the progress that's happening together. And it gives you an idea if you're going in the right direction. Sometimes just what's happening in the session will start to feel easier between you as well. You'll have a stronger sense of working as a team, and the therapist might notice that you start to find the courage to talk about the things that were very difficult to discuss when you first met. So you keep each other informed about whether the therapy is working. Hopefully your therapist will be asking you regularly about the progress you feel that you're making, so that you're working alongside each other on that. It's a really important conversation to have. Sometimes young people can feel awkward, or like maybe they would seem rude if they say this help isn't helping me, isn't being useful. But in fact, it's one of the most important things that you can tell your therapist, because there are ways that things can be adjusted. You can try new things if the approach that's being used at the moment isn't working for you. There's more than one option for most difficulties that we have identified, and it's good to get the one that matches for you most. There are some really nice little questionnaires that can be used at the end of each meeting just to check if you feel you're making progress, if the approach is working for you. So trying to give as honest feedback as you can gives a really early opportunity to redirect anything that isn't working as best as it could at the moment. That's a really important question to think about, and a lot of it relies perhaps on what you mean by relapse. Getting better usually doesn't happen in a single step. It doesn't just progress always in a forward motion. So sometimes people take a step or two forward, might wobble a little bit, maybe even go back a step or two again. That's completely normal. That's what happens when you're trying to work out a problem that you've been struggling with for a while. It might seem odd to say, but some of those setbacks can be among the most valuable things that happen in therapy. You get a chance to look back at old patterns or old strategies that you used and maybe remember what they were really like, some of the downsides to them, as well as some of the ways they feel a little bit more comfortable or familiar to you. And with that new understanding, it can help you to move on and perhaps recommit to the new ideas that are available. So they're not something to be afraid of, and definitely something to talk about. If the setback is bigger than that, it's more difficult to think yourself out of or really to work past. Again, that's really important to talk about, because it might be an important sign that the approach that's being used right now isn't quite right for you. It might not be the right match or not powerful enough to help you in the difficulties that you're experiencing. And then there are lots of options we can consider to try and adapt the first approach that's being used. For some young people, that will mean involving other people in the therapy. It might be thinking about where they're struggling. Maybe it's at school, maybe it's at home. For others, it might mean that thinking about medication alongside talking can be a way of making the most of the therapy that's on offer. The most important thing is to talk about it with your therapist as soon as you notice it, because there are things that can be done to really match the approach more closely to what you need and help you to feel better. If you don't think that it's working well with the therapist you're working with or in the service that you've been referred to, it's really helpful to say so. Things don't always click the first time you make a plan. So trying to understand what isn't working for you is really, really useful. Sometimes you might find that simply that conversation is enough to redirect or adjust what you're receiving in terms of help in a way that makes it much more useful to you. But it might be that that isn't enough, and trying a new approach or working with someone else is the best thing for you. You and your therapist might well be able to come up with a plan for that together. Whatever you decide, it's important that the options that are available to you are set out and considered ahead of making any decision, looking at the advantages, looking at the disadvantages that might come with that. For example, there might be a delay that comes with moving to another service or to another therapist, and knowing how that balances with continuing the work that you're doing is an important decision to make. So taking time to carefully consider that with support is a great thing to do if you're really not sure about the help you've been offered.